Great. Okay, so welcome everybody. Thanks for coming, and we hope to, get everybody ready for next Friday. I sent out the agenda, which is similar to what we've done before. I tweaked it a little bit, giving the simulation a little more time, but the order of things is going to be pretty similar. When we first start out, 9 to 9:15, we were going to open up Zoom, and then Denise, you were going to put up something that says welcome to and the name of our thing. You should have a slide. If you don't have that slide, I can send you one. But just to let them know that they're there, and then have instructions there about how they can rename their Hollywood Square, we call it, which is the little window that we're looking into. So that, like, mine says just my name, but we want them to put they could just put their first name. We want them to start it with their number, though, of their team assignment. Correct, Denise? That'll help you to sort them into breakout rooms. Yeah, so they'll put their team number first, and then their first name, and then their discipline into their square. So as they're coming in, they'll be able to do that, and hopefully it'll make things easier for moving them into different breakout rooms. Tim McGarriger, who's our acting dean at UA, agreed to just kind of welcome everybody. We have a lot of students. I don't know if you weren't on when I said this, but we have over 100 students. There's like 103 that I had signed up, and they kept coming. I'm like, all right, guys, stop. Save the rest for February. We'll do this again. Like, this is a lot. So I broke them into 12 teams. But anyway, Tim is going to just come on and say, great to see everybody, whatever, and then we'll get started. So I only allowed 10 minutes for an introduction. At that time, I'll talk about just the interprofessional competencies, why it's so important, and just kind of go over like a real brief couple of things about the day, so they know what we're going to be doing that day and that sort of thing. After that, we'll do what used to be in poster form, which is topics related to what they would have seen already on the didactics, but just to kind of give them some just-in-time training about this is what you need to know as you go forward and get ready for your simulation. So I put these in order. Sue Fosnight asked to go last. She's not available for the whole day, so she wanted to be close to the huddle. She's going to do the huddle, and she's going to do her opioid poster. So I have her last. Patty, I put you up first for nutrition. Are you good with that? Okay, and I sent you the most current nutrition poster. So what we've done before is had everybody share their own, but send a backup of their presentation to Denise. And so I put her email address in this agenda just so you could have it nice and easy. So if something should happen, you're having trouble sharing, whatever, Denise can kind of be the Wizard of Oz behind the curtain and throw it up there if you need it. Okay, so we got Patty with nutrition, Ricky, caregiver stress. I have function with aging, but then when I went back and looked, we have a dementia delirium, which I think, what do you guys think? This patient or this caregiver, Mrs. Hall, does have function issues, and she's caring for someone with dementia. Thoughts? Sue Hazlett, what do you think?
You're asking whether or not to do that actual presentation.
Yeah, I'm asking, do you think our students need the dementia delirium more, or do they need the function with aging? I guess we could ask Jen's here too.
I would say for this case, function.
Do you? Okay. Okay, I was kind of torn because they both apply, but is that okay with you, Jen?
Yeah, that's fine.
Okay, all right, great, thank you. Social determinants of health. I was having a little trouble finding someone to do that. So I've asked Brandy Trzynowski, who's done it before. Yeah, my UA faculty are not available on this date, so I'm having trouble getting that filled by my social work faculty. And then Lori Kidd, I asked her too, but she teaches on Fridays this semester.
If needed, I could maybe punt on that if I could just have a little bit more support, just what maybe some other people are doing.
Yeah, we have the information. It's just a matter of taking somebody through it. But thank you,
You know
Jeff,
what?
for offering.
You know what else we have, Diane?
What?
We have a recording. We recorded how to do this. We actually had a recording of somebody presenting that poster, if that would be helpful,
Oh, okay. Yeah, that's true.
that he could watch that if he wanted. We could send that on.
Okay.
We just looked at that not that long ago, right, Denise?
Okay. I just sent it out to Brandy this morning just to tell her that Lori Kidd couldn't do it because I told her I was going to ask Lori first. And so if for some reason Brandy is not available to do it, I'll check in with you, Jeff. Thank you.
So we also have social determinants of health in the LMS. It may be that poster. I'd have to open it up and look.
Yeah, we usually give them that, just a real quick overview of it with one of these presentations. But as an example, yeah, that would be another place to look for that. So there's going to be 5 10-minute slots of presentations for 50 minutes, and then we go to breakout rooms for huddles. We saved the team steps one to give more time for Denise to put everybody into a different set of groups. She's going to be moving them into discipline-specific breakout rooms so that they can get report on Mrs. Hall. So I listed who I thought would be doing those huddles according to who's done them in the past. Jess, you'll definitely be with Sue. So I guess I need to make sure Denise knows that too. I didn't have that on the original agenda, so make sure Jess Emshoff goes into the pharmacy huddle with Sue.
Okay.
And then, yeah, all of the others I just kind of chose by profession. Does anyone want added to any of these? Okay. All right, that sounds, so at that time, so we have 20 minutes to give that handoff. So we have the option to let the students see that huddle sheet that's the synopsis in advance. And I think that's a good idea because it's a lot of reading and discussion to happen in 20 minutes if they don't at least get this synopsis in advance that they can read about Mrs. Hall. And then you can really focus in that 20 minutes to really go over, okay, here's what you need to know about your profession. This is what you need to bring to the meeting. And like 2 to 3 points is what we tend to do in that huddle. Does that make sense to everybody? Yeah. So the best, go ahead.
Question, am I in that huddle or am I further down in the,
I did not slot you into a huddle, but I am happy
Okay.
to add you to one if you want to be there. I have you doing the simulation.
okay, that's fine. I was just checking.
Okay. Okay.
That's fine. So I'm further down in the actual simulation.
You are, yes.
Okay.
Yeah. So the best way, what do you think, to give the students this synopsis, which I sent out to everyone, so you had that too, but we could put it in the LMS or we could distribute to the students that we recruited on their own, you know, separately as faculty. How do you think the students would be most likely to pay attention to it? I guess we don't have to all do it the same way.
Or both,
Or
to
both.
be sure.
Yeah, or both. I'm thinking the nursing students, Lisa, what do you think? I think we probably need to send it to them because they're going to be like, yeah, and like not read it.
I would agree. We should send them. Yes, I agree, Diane.
Yeah, and say, read this over. This is something you're going to be discussing. That way you're not spending the first, you know, half of your huddle like, okay, let's read this together. You know, they should have that read already.
Okay.
All right, so let's do both. Denise, you can put this on Canvas,
Okay.
the synopsis, and then I'll also send out a message to all of the faculty that sent me student names to share it with their students so that they're paying attention and that it's also on the LMS. Okay.
Diane, would you be willing to remind us of the student names, even the ones we sent you, just to be sure we get to them all?
Oh, yeah, I'll send that out. Because what I'll do too, maybe what will make that a combination, because we want them to know their team number. And so I'm going to put that on the list of the rosters. You know, I took what you guys gave me and put it into an Excel. And so I'll send you your group of students and put their team numbers. So when you send them out this huddle sheet, say, this is your team number. You need to know this when you come, because you're going to put it with your name when you come to the Zoom and rename it. So that way, maybe that'll be like one communication. So it'll be those two things together. Okay. So the team roster number and the huddle synopsis, that'll go out to students. Okay. Great. All right, so the next thing that I will come in for, she'll pull us all back into the main room, and then I'll do the last poster, 10 minutes of the team steps. And this will start then like a 15-minute block of time where Denise is going to start reconfiguring students into their interprofessional team. So when that happens, we'll all be in our teams. So the facilitators on your agenda I put was to be determined, because I hadn't figured out where everybody was going to be divided up, but I will let you guys know. I'll send that out so that you see what students you have on your team and what diversity you have, between either 8 or 9 students, and there's either 5 to 6 different professions in each of the teams. So like I said, I've got, you know, really good diversity. So there was very good recruiting in response to this call. So you'll know in advance. So I gave an extra 5 minutes to the simulation, and I took it away from the wrap up at the end, because it seems like by the time you get to the wrap up, they're all like, yeah, a couple of people share and they want out. So I thought, let's put more time where we want them to really be engaged, and that's in the simulation and the debrief. So between 30-35 minutes for the actual simulation, then 20 to 25 minutes for the debrief. I did some more work on the debrief, giving you some more instructions on the facilitator guide. So I was trying to think of the best way to give you this information. So there's some details for each of the steps at the bottom of the agenda, and then just some general guidelines about the team meeting simulation. And then some specific things are on the facilitator guide that summarizes the main points that we want all students to start out with: caregiver stress. So, you know, some words are there to help you get the ball rolling, give them a chance to introduce themselves. That's where I feel like we needed more time, because when we were in person and we had them at tables, they were able to get to know one another before, you know, you got to the point of the simulation. Whereas now that we've got them in virtual format, they didn't have that opportunity, because they weren't, you know, together until that exact moment that we put them into teams. So let them introduce each other. There will be one nursing student that will be assigned to be the family representative. We don't have standardized patients for the simulation, and so we have adapted it to be one of the nursing students, because I have 2 or 3 for each of the sim groups. So one of the groups, and Sue Hazlett, I am asking you to do that huddle with the students who are assigned to be the family member.
Okay.
Because I put Margie with the social work, because I didn't have anyone who's done a huddle before in social work.
That sounds good.
Okay. So you can give them the scoop. Make sure they know their role is not to be a nurse in that simulation, but to, you know, I'm the daughter or I am the son. So facilitators, when you get into your simulations, know that one of the students will be the family member, and I'll have that marked when I give you your team, so that you know who, you know, what it is. There was some confusion about that in the past, like they weren't realizing what they needed to do as that family member. So We talked.
Diane,
Go ahead,
do
Sue.
we have anything that they can use for notes? Like I know I didn't see a facilitator sort of guide for that role. Didn't we have
No.
it?
No, but I was thinking too, maybe you want something in writing for them. Is that what you're
Yes.
thinking?
Yeah, okay,
Yeah.
okay.
Diane, will they be with the groups the whole time or will they be sent in later after the simulation starts?
I was thinking they would be there the whole time just to make things a little easier. I know when they were SPs, we would send them in later.
Can I pop in an idea quick?
Sorry, Jeff, didn't hear.
Can I pop in an idea quickly?
Yeah.
For those small group meetings, we've used in the past like an Office 365 or a Google form so that they could keep their notes electronically as they're working on it. But then as facilitators, either in the background, we can monitor their sort of progress during those 20-25 minutes because it's all synchronous, which is really valuable. And then for the large group debrief, then you might choose certain groups to share what they talked about or where they got stuck. We had sort of a visual on each of the groups while they were working. And I know this is late in the game for that to happen, but it's not super difficult.
I like that idea. So because we have them in the team meeting, we ask for a scribe, someone to keep track of what are the plans you're making, the decisions you're making for this group.
You can drop that link into each of those small group rooms.
Yeah.
It also makes it nice if you're going to do any research on this to find out, what the barriers were or the bottlenecks were for their interprofessional stuff. So
you use Google Docs or you used?
I've done both. 365 it's just more Microsoft-y.
That's a good idea. Okay.
We can talk offline about that if you want.
Yeah, that does sound good. I'm sorry, I'm not paying attention to chat.
I would just comment on that, like having to find a platform that's universally accessible. Like if I'm at the hospital, there's a pretty big chance that something like that will be difficult for me to access. Anything Google is definitely blocked for us. We just switched to 365. There's lots of hiccups in that process too, so that might be an available option. But yeah, any of those like file sharing types of things are difficult depending on where you might be. Yes, in a healthcare setting. But I like the idea, and I wonder if there are maybe some things within Zoom that we may be able, that we may be able to utilize as well.
Yeah, I wonder.
Or the LMS. I don't know about that one.
But getting back to the family member, you were asking, I think you were asking, is that are they going to come in late or are they going to be there in the beginning? If there's any way possible, but they're going to be meeting with Sue first, right?
Yeah, that's when everybody's in a huddle though.
Oh, okay.
I don't know. What do you guys think that have done it before? It would be a change. I was thinking about it yesterday when I was putting it together. When we did it before they came in, they were there already. They didn't come in late.
I
Yeah, I
think
think the last
we're to hold them back just because they are students who are actually, trying to learn from this experience as well.
That's
So
right.
I think that would be unfair a little bit to them.
Right.
I would agree because they want to, as long as they understand, what role they're playing, but I think they should be there for the actual interdisciplinary exchange because that's where I think the learning takes place.
Yeah, I agree. Yeah, that definitely is a strong argument for not holding them back. So they'll be there the whole time. There was a question I see now in the chat, will they put family member in their Hollywood Square? And yeah, I think they should. So Lisa, the nursing students are being asked to do this. Is there a chance you guys could talk to them about that before next Friday?
I could send out, let me see, I don't think I will, well, I will see them in lecture Wednesday.
That would be perfect because that's
Yeah.
2 days away. So just say,
Yeah.
you know, some of you are being asked, and you know, the benefit of this, and I put that in a debriefing question, did they take anything away from being in that role as a family member and what it would be like for them coming in to a team meeting and that kind of thing. So it's not that they're not important to the discussion, they're actually very important as that family member. So
And it's actually true
tell it in a good
because
way.
sometimes as a professional, your loved one is being cared for or under hospice care and you have to play that dual role. So that'll be a great experience for them to, you know, be able to recognize that in your profession that does happen. And as they're preparing for to play that family member, just, you know, they just develop that mindset and you know, kind of imagine themselves in that role, but still having their nurse hat on as well. But when you're, you know, at the bedside of a loved one, you do have to exercise that restraint. And it's like, yeah, and I think it's a powerful experience because in reality, it's not an easy thing to do when you're the professional and your loved one is being cared for. So they actually are going to have a better experience than the rest of the team because that's more real.
That's a great point and a different way to approach it. And I'm glad you brought that because often the healthcare provider in the family is the one who's called upon, you know, to be that representative. So I'm going to do that. I'm going to make it your, you know, you are a nurse and your family member. So yes, Judy, learn both hats. I love that. Thank you.
How to navigate through that experience. And so,
Yeah.
but Sue, if I think I'll be full, so I can come into that part of the huddle if I'm not. When I do stuff virtually, I get a little mixed up with the timing. But if you want me in on that and I can still do the other, let me know, Sue. Okay, because we can help set the stage for that.
Perfect. Yeah. Sue, do you want Darsha to be added to that huddle? We got to let Denise know.
That'd be fine. Yeah.
Okay, perfect. Okay. All right, so there will be reminders sent out to transition to the debriefing. And so I listed, you know, several debriefing cues that you could use, how you can start it, see how it starts to evolve from the students' own reflections with little cues, but then if you need to prod them along, making sure that they're talking about teamwork, communication, how did it go? Did they, how did they handle like the missing disciplines, which by the way, missing disciplines during your simulation, you can pull from, I labeled them as notes in the, it's the, what's the name of that document I sent you guys, but I put the hyperlinks at the top of the document so that you could quickly move to that section so that, for example, there's no physical therapy students that are coming. And so if you want to, as a facilitator, bring in the physical therapy note and just say, you know, as the facilitator, I can tell you that there's a physical therapy note here and this is what they say. Because Mrs. Hall has a knee issue. And so they may be saying, well, she needs therapy, blah, blah, blah. Well, here's what the PT note says. You can provide that. Same thing with OTs in there. We don't have any students from those professions. So there's, like I said, there's some cues there. Make sure they talk about teamwork, communication, how they interacted with the family member, incorporating them into the care. And then you can talk about the actual plans that they made too. Were they comprehensive? Did they include, you know, all of the things that they learned about? And you'll have 20 to 25 minutes, depending on how quickly you transition to debriefing. You can have a good amount of time to talk about those things. So Denise will send out a warning when it's coming close to pulling everybody back into the main room for the last 15 minutes, which is when I'll do the large group debrief and just ask them to share their experience. And at that time, we'll have Denise put the link so that they're doing their post evaluations. And so I like to finish a little early because I'll say, click on that link now and go do your post education evaluation. So we get that feedback right away.
So since we're gonna do that, Diane, do you want me to also then put the certificate link up as well, or the document for the certificate?
Well, let's hang that out as a carrot on finish your evaluation and then you can get your certificate from the LMS.
Okay, all right,
Because if you give them a certificate, then they might not do the eval.
right.
Yeah.
What is in this evaluation? Like, what information are you getting?
They're doing a post, there's a pre-post of an interprofessional collaboration tool, which is
The ISVS.
the ISVS. So they're going to do it before, they'll do it after. Then there's a satisfaction with the education survey also. All right, any issues that we also want to talk about while we're together today?
I'm sorry, just for clarification, are the students navigating themselves to the breakout rooms? Are they pushed or are they pre-assigned?
They'll be pushed,
They'll be pushed, okay.
Sort of push, they have to hit accept, right?
right? Or
Yeah. So,
join.
yeah, so they will have something pop up on their screen that says you're being asked to join room 1 and they need to say, okay. Yeah, but Denise puts them into that and then sends out the invite so that they're being directed to the right team.
And that's true for facilitators too, as well, right?
Correct. Yeah. Yeah, facilitators also. Any other questions, comments?
All right, last one. Is there CE available for the facilitators?
No,
No, okay.
I've never done that.
Okay.
Not a bad idea.
Well, it might be some neat ways to bring in some people. Yeah.
Yeah. When we did it for professionals, I think we did CEs. When our trainees were, we do this for the licensed professionals too. But no, we don't do it for our facilitators. Good idea.
Is the Zoom link for this on any of the documents that you've sent out, or are we still waiting on that?
Not yet. Denise, how are we going to distribute the Zoom link?
Well, I have all the student emails and the facilitators. They're all on your list as well. So I can send out the calendar invite with the Zoom link. That way, plus I will post it in the LMS, just like the invitation.
Perfect.
Because I'll need to post in my LMS correspondingly since I don't have access to yours. So
Okay.
look at that for my students.
Jess, do you want added to the Canvas? Just so you can poke around. I know this is your first. Yeah. Denise, if you could add Jess
Yeah, okay.
to Canvas, that would be great too.
I'll just go ahead and add all of the facilitators, and that way, if they choose
Okay.
to go in, they can.
Okay, great. All right. All right, Jeff, it's your first time with this, so I did put you as a co-facilitator. I put you with me. So we can work together.
Look forward to learning.
Yeah. I bet we'll learn from each other. All right. Yeah, if there's anything else, don't hesitate to, send an email, ask a question. Hopefully we've thought of everything today, but if there's something that we forgot, just shout out. Okay. All right, I'm better looking at the chat. I see your question there now, Jeff. Okay, well, thanks, everybody. I appreciate your coming in, and I hope you have a great weekend. So we'll see you guys all next Friday.